Well, I want to talk about athletes, particularly now the Olympics are going on, and invariably you have all these world-class athletes they've been performing almost their entire life, and these are the cream of the crop. And they pull their knees, and they pull their hips, and they pull their backs and their ankles, and they fall down because of lack of balance. They get muscle cramps. They get all these injuries and things from just what would be a minor thing usually. I mean, we're talking about competition at the world level, and they're just falling apart. What's going on here? Well, I want you to get a hold of that CD called Dead Athletes Don't Lie. I want you to get a hold of that CD, Women, Athletes, and Kids. And then I want you to get the book, Rare Earths Forbidden Cures. Rare Earths Forbidden Cures. And instead of drinking soft drinks, instead of drinking, the classic soft drinks, instead of drinking the diet ones, or even juice, or maybe some of these sports drinks that have 2 nutrients in them or 6, get a hold of Rebound, along with your 90 essential nutrients. Rebound. And it has 100 nutrients, including 77 plant minerals, including all 60 essential minerals. I'm telling you, if you work physically, if you just kind of work out at the gym 3 nights a week, or if your kids are in Pee Wee League or Pop Warner Leagues, or they're in junior high school or high school, they're in college, they want to be part of some developmental league, thinking about the pros, they want to go on to college and get scholarships, you really have to be obsessive about this. I want you to get a hold of that book, Rare Earths Forbidden Cures. You really need to look at this. There's whole sections on athletes, what happens to them. People who physically work and athletes, regardless of their age, gender, sport they're playing in, they sweat. That's kind of a universal thing. That's 2 things. One, to stay cool, but also they lose nutrients in their sweat. Sweat is not water. So drinking water, drinking sports drinks that have 2 minerals or 6 minerals, it just doesn't cut it. You need all 90 essential nutrients because you're sweating out a soup of all the nutrients, right? If you have 52 nutrients floating around in your body because you have a very bad diet, you're going to have 52 nutrients in your sweat. If you have 75 nutrients because you have a pretty good diet floating around in your blood, that's what's going to be in your sweat, 75. If you're taking all 90 essential nutrients and you're sweating out your 90 essential nutrients and you're just drinking water, you're in trouble because as you sweat, you're losing these nutrients. The reserves go down. If you have a little bit in reserve, you're going to sweat them out, and just drinking water makes it worse, okay? Because it's like if you were to lose a quart of oil in your car and you replaced it with water. Would you do that? No, you wouldn't do that to your car. Then why are you replacing your sweat with water or sports drinks that have only 2 or 6 minerals? I want you to get a hold of Rebound. It comes in sticks. You tear off the top, put it in your drink. I take 2 servings of Rebound a day, even when I'm not physically working out, because you sweat. Even in warm weather, you sweat just to stay cool, so you're losing nutrients even as you're staying cool during the warm weather. Even if you're not working out or not emptying trucks or not digging ditches, not working in the garden, you're still sweating just to stay cool. Then I want you to take the 90 essential nutrients, especially if you're working physically, if you're an athlete, because you're putting strain on your joints and your bones and your ligaments and tendons, connective tissue, cartilage, disc between your vertebrae. And I was talking to a guy today. A couple of his associates called me about a friend. He's 42 years old. He has atrial fibrillation, which is caused by degenerative disc disease. And, of course, the doctors have already started with all these heavy cardiac procedures. It's a back problem. And then he's also got high blood pressure. He also has degenerative disc disease up in his neck, and he's got tingling in his hands when he wakes up in the morning. And doctors are talking about surgery. They've already done a little bit of surgery on him, and he doesn't want any more. That's why he consulted his buddies who are associates. And what this guy needs, of course, is he weighed 195 pounds, so he needs 2 healthy bone and joint packs, 15 glucogel a day to support and promote maintenance repair of those discs, make them thicker, push the vertebrae apart, get the pressure off the roots of those spinal nerves. Atrial fibrillation goes away. The tingling, numbness, your hands go away. Give me 90 days. Give Youngevity 90 days. If you have arthritis, if you have osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, rheumatoid arthritis, if you have anything going on with your back, degenerative disc disease, ruptured disc, bulging disc, you have peripheral neuropathies anywhere along the line, you have anything wrong with your neck, any of the peripheral neuropathies, including irritable bladder, is caused by peripheral neuropathies coming out of the lumbar area and the internal branches of the peripheral nerves. And you have things like the atrial fibrillation, which is a peripheral neuropathy of the spinal nerves coming out from between T1, 2, 3, and 4. That's thoracic vertebrae 1, 2, 3, and 4. And this is where hanging out with the Youngevity group, you're going to save yourself an enormous amount of unnecessary misery, risk going in and getting infections, C. diff, Clostridium difficile, because your doctor didn't, your surgeon didn't wash his hands after he went potty. They kill you. Why would you do that when just a simple nutritional program can support and promote maintenance repair? People say, well, if that were true, my doctor would have done that. No, your doctor spends his whole life trying to make sure he gets every penny out of your insurance policy he can. And you say, oh, come on, Wallach, you're too, what's the word I'm looking for? Too skeptical. You're too cynical. That's the word. You're too cynical. Well, according to the Institute of Medicine, in September 2012, medical doctors defraud their patients of $750 billion each year, unnecessary operations. They bill for things they don't even do. $750 billion, 1/3 of our medical billing is fraud. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, this is one that vindicates you. Fox News story here, headlined, mammograms do not reduce breast cancer deaths, according to a Canadian study that lasted for 25 years. It included nearly 90,000 women from the ages of 40 to 59, and they followed them for 25 years, and researchers found that the same number of women died of breast cancer over that 25-year time period, regardless of whether they got mammograms or not. They go on to say that mammogram is performed routinely to screen women for breast cancer. It's highly debated whether the screening saves lives. And they go on to say also controversial whether the potential benefits of mammograms outweigh the harm done by overdiagnosis and overtreatment. The new study found that 22% of breast cancers detected by mammograms were what researchers would call overdiagnosed, revealing that tumors that didn't cause disease symptoms and would not have reduced the woman's lifespan if left undetected. This was all published in the British Medical Journal, and they say that the rationale for screening by mammography should be urgently reassessed by policymakers, according to the researchers. And in an editorial that accompanied this by Dr. Mette Gallagher, a breast cancer surgeon and former head of the Norwegian breast cancer screening, says the study's findings do not support the screening of women under the age of 60. However, changing the policies may not be an easy task because governments, research funders, and physicians may have a vested interest. And I suppose that's what the interest would be. And, of course, the U.S. Preventative Task Force came out couple of years ago and said that women ages 50 to 74 should get them every 2 years. Of course, the American Cancer Society says you should get them every year starting at age 40. And in this particular study, they said there were 3,200 plus women that got in the mammography group and 3,100 in the control group that were diagnosed with breast cancer over the 20-year time period. 500 women in the mammogram group died, and 505 died from the control group. They also suggested that one out of every 424 women that underwent mammograms, they found that they were falsely diagnosed with having breast cancer. So once again, something you've been talking about for a long, long time has come to light.
Yeah, I've been talking about that for at least 30 years, and about 10 years ago, there was a similar study that was done by the Harvard School of Medicine. They published it in the New England Journal of Medicine, and they said exactly the same thing. In fact, one of the dangers that they didn't really give, and I was listening for it here, was that one mammogram gives you the same radiation as 500 chest x-rays. I mean, if you didn't have breast cancer, it's going to give them to you. Okay, one of the things they found out just recently, came out in the New York Times just a couple of weeks ago, that the rate of increase in cancers in America is just outrageous. Just outrageous. It's like each year it goes up by 29,000 new diagnoses of breast cancer. Why is that? Because women are getting so many mammograms. The radiation for the mammograms are giving them the cancer. And so it's kind of like one of those, and the title of the article was, Are You Giving Yourself Cancer? And so I just urge women again to do self-breast examinations. And, of course, the book Let's Play Doctor tells you how to do that. Do your own self-examinations. If you feel something that's different and whatever, I'd get a high-resolution ultrasound. No radiation. It's like $50 instead of a couple of thousand. do it yourself and stay ahead of the curve. Don't get your breast cut off like Angelina Jolie. Do self-breast examination. If you have anything curious, get a high-resolution ultrasound. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Boise, Idaho, and Frank, you're on with Dr. Wallach.
Oh, Frank, you're on the air.
Hi, Doc.
Hi, what's up?
I've got a dog that has probable spindle cell tumor, and it's fibroplasia. And the vet wants to operate on him. He's about 10 years old, and I'm concerned about that.
Sure. Where's the tumor located?
On his chest.
Okay. Now, is it under the skin or in the skin?
It is under the skin.
Okay.
It is in the muscle.
Yeah. Okay, and how big is it?
It is, she wants to go 1.5 inches all the way around it, which would make it about a 6 by 8 inch square on about a 60-pound dog. So pretty much his whole chest cavity.
All right.
Is what she wants to take.
All right. How big a dog is this?
He's 60 pounds, about 2.5 foot tall, 3 foot
And how long has it had that tumor there?
It's been slowly growing, about 4 years, I'd say.
Mm-hmm. Okay, and did they do an ultrasound and x-ray?
They did not do an ultrasound or an x-ray. They did blood work, and that's how they came up with spindle cell tumor and fibrosis, fibroplasia.
I'd be amazed if you could make that diagnosis from a blood work.
Okay.
Okay. Yeah, I'd get an ultrasound of that. No radiation, very cheap. And if they don't want to do it, there's a whole phone book full of veterinarians who are hungry right now, right?
Right.
And so what you want is a high-resolution ultrasound of that mass, and let's see what it is. You can't tell from a blood test. So that makes me highly suspicious.
Is there anything that I can be giving him
Absolutely.
right now?
Yeah, it was a 60-pound dog.
Yes.
Yeah, I'd give him 3 scoops of our Arthrodex every day in his food. I would also give him 3 of our selenium every day, Ultimate Selenium. And then I would throw in the Cell Shield RTQ. I'd give him 3 of those every day. Okay? And then get that ultrasound, call me back.
What was that last one, or what?
Cell Shield RTQ. R is for resveratrol, T is for turmeric, and Q is for quercetin. Very, very high auric point, antioxidant. Anytime a dog or a cat or a human being or a fish or bird has cancer of any kind, their best friend is selenium, antioxidants of all kinds. You want to get their auric points up, and this will do that, okay? And then call me when you get the ultrasound. I wouldn't be in a rush to do surgery if it's been there for 4 years. And part of the ultrasound is you want to see if it's metastasized to the lungs, if it's benign, if it's a fatty tumor, if there's a stick in there that he ran into running through the grass. You have to find out what it is, and you cannot diagnose a tumor from a blood test. Well, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages.
Let's head to Shreveport, Louisiana, and Lorraine, you're on with Dr. Wallach.
Lorraine, you're on the air.
Hello, Dr. Wallach. I want to get information on osteo and rheumatoid arthritis for a person who weighs about 100 pounds. She's in a wheelchair. She has had this for quite a few years. Her fingers are kind of curling a little bit now, and she's in a lot of pain.
How much? How old is she?
She sounds real congested.
I'm sorry, her lungs are congested?
Well, she sounds wheezy when I talk to her. So I don't know if that's.
Do you know if she has any skin? Wait a minute. Do you know if she has any skin problems?
She doesn't appear to have any real skin problems. Her skin is pretty ruddy, kind of rough looking.
Okay, kind of rough and ruddy. I mean, you're talking about her face. Does she have rosacea, maybe?
No, just like somebody that doesn't really take real good care of their skin.
Mm-hmm. Okay. You ever hugged her?
I bet she weighs about 100 pounds.
Yeah, I know. Have you ever hugged her?
Have I ever hugged her? No, she sits in a wheelchair.
Yeah, okay. The reason I'm asking is I want to know if she has rough bumps on the back of her arms or anything like that.
That I really don't know.
Okay, yeah, you can find out for me. How much is she, how old is she?
She's about 65 years old.
Okay, just a kid. All right, Shar?
Yeah.
What would you do for osteoarthritis with rheumatoid arthritis?
Well, she needs a healthy bone and joint pack, but she needs the killer biotic to get rid of the rheumatoid arthritis part of it.
Yep. And, of course, with the healthy bone and joint pack comes the CM cream. Wouldn't hurt to get an extra jar of the CM cream, and she can use that on her fingers and hands and neck and any place that has pain. Because this wheezing is interesting to me because I think she also has a gluten intolerance, and especially since she has kind of a ruddy, rough, unkempt look to her skin. This can be very, very common with a gluten intolerance. Can't absorb omega-3s, can't absorb vitamin A, can't absorb zinc. You might ask her about her bowels. Does she have constipation? Does she have diarrhea? There's wheezing. I want to know if she's ever diagnosed with asthma. Does she have any children that had asthma? Does she have any brothers and sisters that had asthma? Does brothers and sisters have any illnesses and that sort of stuff? But Shar is exactly correct. For a 100-pound person, I would go ahead and get her one healthy bone and joint pack. I would get an extra bottle of OsteoFX Plus, and I'd get an extra bottle of the glucogel. What I would do is give her 1 ounce of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 NutriCrystal, the 2.0, drop-dead, gluten-free, and I would also have her take 2 scoops a day. It'd be 1 scoop at breakfast, 1 scoop at dinner. And also have her take the 3 EFA Pluses, 1 at breakfast, 1 at lunch, 1 at dinner. And then the glucogel, because you're going to get her an extra bottle, that would be 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner, even at 100 pounds. Shar, how many glucogel do you take a day?
12.
Yeah, you take 12, and you're about 100, 105 pounds. And so that's about right. And she can fully expect to deal with the osteoarthritis part by supporting, promoting, maintenance, repair. But for the rheumatoid arthritis, she needs the killer biotic, as Shar said. I'd have her take 3 twice a day, 2 bottles a month. Call us every 2 weeks. Get her on a gluten-free diet. Call us every 2 weeks. Let us know what's going on. We'll be back after these messages.
Let's go to California. And Tammy, you're on with Dr. Wallach.
Oh, Tammy, you're on the air.
Hello, Dr. Wallach. I have rheumatoid arthritis and Sjogren's and Raynaud's and Candida.
Okay, Sjogren's. And Raynaud's, okay.
And I've noticed that it's hurting underneath my right rib, which I'm guessing is my gallbladder.
Okay.
And also Candida. I am gluten-free and dairy-free.
Stop. How does Candida manifest itself?
Fingernails, tongue.
Do you have any skin problems? Any eczema, dermatitis, psoriasis, or rosacea?
No.
Okay. Do you have any asthma or any time in your life?
No, I do fight with sinuses and allergies, though. I've even had sinus surgery. But I don't anymore since I got off the dairy.
Okay, good. Now, do you have any children?
Yes.
Do any of them have any asthma, bronchitis, or skin problems?
It seems like she's always fighting with a cold.
Okay, so it has chronic upper respiratory stuff.
Yeah, I would say so.
Okay, now, do you have any brothers and sisters?
Yes, I do.
Do they have any problems with respiratory stuff or skin?
No.
Okay.
And one thing I've noticed, I seem to get like these little, it looks like somebody poked me with a pin, a little bit of blood, like I get those, and then also once in a while I'll get these little, they look like little round, dry spots. The only thing I can think of to compare it to would be a ringworm. I mean, I don't know how else to...
Are they the size of the head of a pin? Are they the size of a nickel? What are...
Those are the 2 different things. The little blood that comes up, looks like somebody poked me with a pin, is only like a little tiny freckle or a little poke
okay,
of a
now,
pin.
Does it go away or does it stay forever once it comes on?
It pretty much stays. And
okay.
I remember seeing my mom had them, too.
Yeah, well, they're not genetic. They're not genetic, but they are a signal of copper deficiency. They're called little hemangiomas. Do you have any gray or white hair?
Very.
Say again?
Yes, I do have gray hair.
And how old are you?
55.
55, yeah. These little hemangiomas are caused by a breakdown of the elastic fibers in the little blood vessels in your skin. And it causes those things are called hemangiomas. You got them all through your tissues as well. And basically, the same thing with the hair color is caused by a deficiency of the copper. The worrisome thing is you're going to get things like spider veins, varicose veins, hemorrhoids. Even the more worrisome thing is you can also get aneurysms caused by that sort of thing happening in the major blood vessels, major arteries in your brain and heart, and the aorta and that kind of stuff, which can be life-threatening. So I would think, Char, what do you think's her basic underlying problem here? The gallbladder thing and all this other stuff?
Oh, I would say it's definitely an absorption problem.
Yep. Very good. And so what dietary change would you suggest for her?
Well, she said she's on a gluten-free diet, but she just has to kind of tweak it and make sure she's really, because it sneaks up on you. I know.
Yeah, it sneaks up on you. It's a cross-contamination. The laundry, food preparation surfaces, the bed, the rug, workplace, that sort of thing. The kid goes to school, and she's bringing stuff home, and he's got cracker crumbs all over her clothes, and you put her clothes in the washer with yours, and you get it that way. Now, if you have it, you've given it to her. You give it to all your children. Your sisters give it to all their kids. Your brothers get it, but they don't pass it on. It's not genetic. And if your mama had these things, the odds are she had a gluten intolerance too, because she has a copper deficiency. It's not genetic, but it is caused by a gluten intolerance, which can be familial, but not genetic. Now, because you have a gallbladder problem, did you have it removed?
No, I've never had it removed. And I do fight with sleep, too. I don't sleep well.
Mm-hmm. Okay. All right. So what do you weigh?
2.
What do you weigh?
I'd say between 145 and 149.
Okay. And let's see here. Any other issues we need to know about? High blood pressure, diabetes, arthritis, anything like that?
Rheumatoid arthritis, Sjogren's. I fight with the Sjogren's really bad.
Yeah, Sjogren's. And Raynaud's. Mm-hmm.
I'm trying to think.
Yeah, Raynaud's is also a vascular problem. Yeah.
I'm sorry.
Okay.
One thing I've noticed, too, I seem to be allergic to B12 and vitamin C.
That's impossible.
Pardon me?
That's impossible.
Okay, but when I take them, I will not sleep for 3 days.
Mm-hmm.
I mean, literally.
That's because you're getting some
I'm
energy.
up for 3 days.
That's not an allergy. That's not an allergy sign. You're just getting energy from it. Okay. Yeah, that's not an allergy. All right. You just absorb those things very well. Okay. So that gives me some information. So Char's exactly right. You have a malabsorption problem. And so the first thing I would do is, drop dead gluten-free. Everybody in the household, including the dog and the cat and the bird and the fish, visitors, everybody's got to strip in the garage and take a shower out in the garage and put on some clean pajamas or something before they come in the house. And it sounds obsessive, but you got to be that obsessive. And then I want you to take the ultimate enzymes. We call that the gallbladder in a bottle. Take the ultimate enzymes. At 145 pounds, I would take 1 or 2 of those ultimate enzymes, like 2 to 5 minutes before each meal with a couple ounces of water. It does have ox bile in it and can make your gallbladder happier. If your doctor ever wants you to do something about that gallbladder, just get a high-resolution ultrasound, see if there's any gallstones in there, but we're going to show you how to get rid of those and how to prevent those. You can have diverticulitis in your colon, which could feel like a gallbladder thing too, which is a gluten intolerance. Then, because you have rheumatoid arthritis and 145 pounds, what would you have her take for rheumatoid arthritis, Char?
For rheumatoid arthritis, she needs the same thing again. I would give her the Healthy Bone and Joint Pack and, of course, the Killer Biotic to get rid of the rheumatoid arthritis.
Excellent. That'd be 2 Healthy Bone and Joint Packs per month. Take 1 full dose for at breakfast, 1 full dose for at dinner time. The exception would be the glucogel. Take 5 at breakfast, lunch, and dinner. That'll be possible with the 2 Healthy Bone and Joint Packs. Also, as Char says, you want to get a hold of that Killer Biotic, 2 bottles a month. That'll be 3 at breakfast, 3 at dinner. That's a blend of 8 herbs that actually support your immune system, and 2 of those herbs actually have antimicrobial properties. And, of course, rheumatoid arthritis is not autoimmune. It's not genetic. Rheumatoid arthritis is actually caused by a bug called mycoplasma. And remember, you can cure syphilis in 2 weeks with antibiotics. You can cure rheumatoid arthritis in 2 weeks with an antibiotic called minocycline, and then it takes a couple of weeks or a couple of months, depending on the degree of damage, to support and promote maintenance repair of bones, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, anything that's been damaged by that infection. And then for the Raynaud's disease, Char, is a spastic small arteries in your fingers. You pick up something cold and your fingers blanch and you get very, very painful because there's no blood supply in there. What would you do for that?
Ultimate Daily.
Perfect. You get an A++, girl. And so, absolutely, I'd give her 1 bottle of the Ultimate Dailies per month, the 3 at breakfast, 3 at dinner. They're going to support and promote healthy blood flow through obstructed arteries, and that'll be very, very useful for you. And let's see here, the Sjogren's disease, what you want to do, this is actually dry eyes and dry mouth, is that correct?
Yes, it is. Dry eyes and dry mouth.
Yeah, and this is actually caused by squeezing of branches of the 7th cranial nerve. People who get a more severe version of this is called Bell's palsy, where the 7th cranial nerve or the facial nerve gets squeezed as it's coming out from behind your ear. And in those 2 healthy bone and joint packs, with each one you're going to get a wide mouth jar of CM cream, which is an analgesic and an anti-inflammatory. Put a half a teaspoon down in each ear each morning when you wake up with a Q-tip, like you're trying to get wax out of your ears. It'll relieve the inflammation. You might even get temporary relief. This is going to take 4 to 6 months to rebuild the skull to where the pressure comes off those nerves. It goes away. Call us every 2 weeks. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 Front Life Crusade. And Doug, let's go to callers.
Let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Doc, how you doing?
Okay, sir, thank you. What's up?
Good. I got one gentleman. He fell off a roof a while back, broke his right arm, had surgery done on it, and he's been taking Resolfen and has gotten an allergic reaction to it, and his arms are bleeding and itching all over his body. And he's overweight and has got osteomyelitis.
Okay, now, you say he's overweight. What does he weigh?
250, 6 foot.
Okay, how tall is he, do you know?
6 foot.
Okay. All right. Now, does he have active osteomyelitis? Does he have infection in his bones right now?
I believe so, yes. I believe so.
Okay. And I'm assuming they're giving him antibiotics.
Right.
Is he getting them oral or is he getting them intravenous?
I think oral.
Okay. All right. How long ago did this fracture take place?
Not sure about that. He's from Florida, and they're up here temporarily in Alabama.
Okay, I got you. Okay. Okay, well, here's a guy with some bone trauma, Shar. Got a bone infection. He's probably 50 to 60 pounds overweight. What would you do for him?
Healthy bone and, he needs 2 or 3 healthy bone and joint packs, obviously, to heal the bone up. And I would give him the killer biotic to kill whatever else is going on in there.
Very, very good. A+. All right, yep. Char's exactly right, Anthony. Because he has this ongoing infection in the bone that's very dangerous. Osteomyelitis is a very dangerous thing, can be life-threatening, and can certainly result in the amputation of an arm or something like that. So I'd be a little heavy-handed here. I would give him 3 of the healthy bone and joint packs per month. Give major nutrients to that bone. This is 1 per 100 pounds of body weight, and he's close enough, 250 pounds. It'd be 1 ounce of the Osteo FX Plus at breakfast, lunch, and dinner. 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner. And I give him 20 glucogel a day. That'd be 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. All that would be accomplished by the 3 healthy bone and joint packs per month. Then, because of the osteomyelitis, as Shar said, I'd give him 9, maybe even 12. Yeah, give him 12 of the Killer Biotic. 4 at breakfast, 4 at lunch, 4 at dinner. That'll be 3 bottles a month of the Killer Biotic. And the whole idea here, those 8 herbs, it's a blend of 8 herbs that actually supports the immune system. And the immune system, of course, when it gets supported, and there's 2 of those 8 herbs that actually have antimicrobial properties, can actually help the antibiotics kill the bugs. If this is an open wound, if he's had an open fracture, and they've got a drain tube or something like that in there, it wouldn't hurt to use the killer biotic on it. Not the killer biotic, colloidal silver. That's one. Colloidal silver, and wipe the wound. It's open, or certainly wipe the drain tube, whatever it is, if there is an open fracture there. It's very dangerous stuff, and so you really want to be on it. His personal hygiene has got to be really up there, and you got to get on this because it can be fatal, or certainly can have a limb amputated because of this kind of stuff. Okay?
Appreciate it. God bless you.
Hey, you bet. Keep up the great work. Okay, how much time we got here, Doug?
Just about 30 seconds.
30 seconds. Okay, Shar, you got 30 seconds to tell everybody what they need to do.
Okay, don't listen to the doctors, and I'm telling you, they are the #1 killer of Americans. Doctors, prescription drugs, and hospitals kill more people than all the wars, all the car accidents, all the illegal drugs. Stay away from them, because given half a chance, they will kill you.
Okay, well said. And it sounds outrageous, but, anytime you have a group of people who kill, injure, and infect 15 million of their customers every year in their workplace, 15 million are killed, injured, and infected in their workplace, and doctors get a walk. That's according to the Center for Disease Control and the Journal of the American Medical Association. Stay away from them if you can. Give us 90 days before you make your decisions. Get second and third opinions. We'll be back another day. Thank you so much, Shar. Good job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.